Hey guys, student doctor Christoph Isbjorn here, and today I'm going to tell you about the 3 reasons that I chose to become an osteopathic physician. Reason number 1 is that osteopathic physicians are able to practice osteopathic manipulative therapy, or OMT. This is such a cool tool to have in your toolbox, guys, that I can use my hands to help with so many musculoskeletal problems, which are a predominant source of complaints that people come into most clinics and offices for. The other thing that makes this so awesome is it's a systems-based approach to medicine. So if you have low back pain, I might start looking at your ankles and look at your feet and look at the way you walk and see if there's something with your gait or your ankles or your knees all the way up to your hips before we even start looking at your lower back, to just rule everything else out to make sure that we're starting at the right problem. Now, osteopathic manipulative therapy is something that has a bit of contention between some MDs and DOs. And what it really is it comes down to various techniques that deal with soft tissue, massage, and lymphatics. It's there to give a whole approach to kind of get your body back into a form where it can self-regulate and self-heal. That's one of the osteopathic tenets. Now, osteopaths are also able to do some sort of bone manipulations, usually around the spine, but along pretty much anywhere that there's bony structure. So wrists, elbows, a lot of joints. And we're a lot less aggressive and scary with our manipulations than something like a chiropractor would be. For instance, my wife was having hip and low back problems pretty much ever since I've known her, which has been about 10 years. During that time, she has repeatedly gone back to chiropractors for help with her back. It gave some alleviation that day, maybe into the next day, but she was going almost on a weekly basis. And that's something as an osteopathic physician that we would not be okay with. If our manipulations are not correcting the issue within about 2 to 3 treatments, we would start looking at something else because something else is clearly causing the problem. So as I was going through medical school during my first year and I started learning some of these osteopathic techniques, I started using them on my wife to practice. We did one session. It took about 2 hours for me to get through everything and do everything I needed to do. But she was great after that. After the first session, she stopped seeing her chiropractor. Within 2 sessions of me helping her over the course of about 6 months, she hasn't had any issues. It's been about 6 months now. All that to say, it's such a cool tool to have, and it's being able to treat family members and friends and get that reward that physicians talk about with helping a patient overcome something that has been either chronic or just getting to back to that level of health that they had before is something that's so exciting, and one of the main reasons that I love medicine. The second reason that I chose to become an osteopathic physician is I love their approach to medicine and their philosophy about what health is. The very first osteopathic tenet states that a person is a unit of body, mind, and soul. And I love that. For instance, my dad, when he fell off of a roof, it was about a 20-foot fall, he shattered his ankle and needed surgery on that. And that was about 2 years ago. Ever since then, he has had pretty bad, steady, constant low back pain that physicians couldn't seem to figure out how to get rid of it. They gave him muscle relaxers. They were talking about doing some sort of exploratory surgery. All they could really do for him was give muscle relaxers or give more narcotics to try and just dull the pain. Within about 90 seconds of a treatment that we use called counterstrain, I was able to help him alleviate that back pain. And where the pain was coming from was his fascia, the sheathing that kind of goes over your muscles, had bunched up. And we have a technique, again, counterstrain. It's a 90-second technique that I just use my hands for. And as you press into that knot, you give it some constant pressure after getting them into a certain position, and you can feel the tissue texture start changing as it goes back to where it's supposed to be. And within 90 seconds, he was amazed that he had no more pain. He felt kind of tentative about it. The next day he woke up and he was like, "Chriser, I can't believe that I still don't have pain in my lower back. I've had that for 2 years." I just talked to him a little bit ago. He was saying that he still has no pain in his back. It's incredible. So these techniques are something that are so valuable and so vital to have, and such a great tool to add to the muscle relaxers, the narcotics that we're able to use, antibiotics, all these things. They lead to what the fourth tenet of osteopathy is, which is rational treatment of the patient. And rational treatment essentially says, if you're doing something and it's not fixing the problem, stop doing it. Find something else. That's not the problem then. And then with the osteopathic tenets also lends itself a lot towards public health and prevention. And I love that because the whole point is to help people not get sick and stay out of a state of disease. And so if we can prevent that, why wouldn't we do that? I love that approach to medicine, that food, spiritual life, that mental health all factor into physical manifestations of a person's being. And the third reason that I chose to become a DO is because DOs tend to go into general practice specialties. These general practice specialties are things such as family medicine, internal medicine, pediatrics, OBGYN, and some people consider emergency medicine a primary care health field. My backstory consists of being an EMT for the last 10 years, and in that time, I have had the ability to work in remote areas such as the top of Pikes Peak up at 14,000 feet. I've been able to work internationally in Iraq, Ecuador, and a few other places around the world, and I've been able to work in urban centers. I was running on an ambulance and working in an emergency room in Denver at level 1 trauma centers for a while. I have a wealth of experience, and I know it's all in emergency medicine, but I love the breadth that gives me as a scope of practice. And so going into medical school, especially as an older non-traditional student, I entered medical school at 32 years old. I want to have that breadth of experience and that huge scope of practice that I'm able to do. And then finally, looking at international medicine is something I really love doing and something my wife and I want to have as a big part of our future plans. So being a DO gives me the OMT that I can use to bring internationally and use that skill set, particularly in resource poor environments where we might not have access to surgeries and medications. So having that skill set will be very important. And secondly, DOs are able to practice internationally in many countries, almost like 50 plus, something like that. And the AOA is also working very hard to make sure that DOs are able to go practice in Europe, because right now they have full practice rights in most of South America, most of Africa, Australia, and New Zealand. But in the European countries, there are people who are able to obtain a diploma of osteopathy. This allows these individuals to do a lot of the techniques that we use in osteopathic manipulative treatment, such as massage, the lymphatic techniques, those sorts of things. However, they are not allowed to prescribe medications or do surgeries. A lot of American-trained doctors of osteopathy, it jams them up when they're applying for licensure, because these foreign countries see osteopathic on their diploma and on their license, and they say, oh, you're an osteopath. Well, then you're not allowed to practice as a physician. So the AOA has gone so far as to get the United Nations involved, the UN, to pen a letter that says American-trained doctors of osteopathy should be treated the exact same internationally as US-trained or any trained medical doctors, MDs. And that's a huge step. That's something also that I think I would like to get more involved with, is the legislature of ensuring that DOs have full practice rights internationally as kind of a last step to equivalency of MD versus DO debate. So those are my top 3 reasons for why I'm becoming an osteopathic physician. If anything I said today resonates with you and helped you choose to apply to an osteopathic medical school, please leave me a comment below and tell me what it was, and tell me which schools you're applying to. If you're a current DO and anything I said reminds you of why you applied to become an osteopathic physician, please let me know that as well. I'd love to hear from you. And finally, I don't have an ending catchphrase. If you think of something fun, put it in the comments section, let me know. I'll give you a shout out in the next video. Until then, keep popping.